With the Arizona Rural Women's Health Network, we're a statewide network. We're HRSA, Office of Rural Health funded, Office of Rural Health Programs funded in our final year. And I wanted to talk about a snippet of what Andrea talked about. It's more about capacity building within the whole community change model. And in this case, it's the lay health workers, also known as promotores or community health advocates. This is just a group of my network members to show you how diverse we are. We're horizontal and lateral, and we work very well collaboratively together, believe it or not. We don't compete with each other. It's amazing. We have community health centers. It's a great thing. So, nonetheless, some people hopefully have heard of promotores. It's the word's interchangeable with all the other words I've talked about as far as community health workers and community health advocates. They are so integral to public health in a community because they are the knowledge keepers. They're trusted. They're the ones that know exactly who to talk to and how to provide the services. And as they're in the home talking with everyone, they're also asking, hey, so Connie, I'm here to see you, but is anyone else in your house? How are they doing? And so it's not just a one-on-one cut and dry service like you might receive in any other type of healthcare setting. So these are just some photos that, showing our girls in action here. So there's several definitions, and I have a bunch with me. APA, American Public Health Association, there's a gazillion core models, but the basic things in this context is bridging cultural mediation between communities, health and social services, and building individual and community capacities. So it's going back to maybe what the docs did 50 and 60 years ago. It's using that same model more for a lay health worker. Here's another study by the University of Arizona, and of course it did the same thing. Decreased ER visits. I'm not doing so well talking so fast. But nonetheless, again, they're positive representatives of their communities, their agencies they represent, and they're huge, value in for their assets. This didn't turn out so well, but this is a literacy model that just shows the links between the support, the human resource, the capacity building, and the links. And this also at the bottom says links to health systems and community ownership. So, like I said, with Andrea's model, it's a small portion. It's more capacity building within that framework. But I wanted to let you all know that this, you have to start somewhere. And if you start with capacity building, then the community change doesn't seem so large. It's kind of one step at a time. So then I wanted to compare that with affordable care. So we've all heard about the navigators, the non-navigators, and the A1, the accountability, the certified application counselors. So those are not going to be anything related to what the promotores are. Those will be a different entity altogether. So with the Affordable Care Act, the marketplace is going to have either a navigator or a non-navigator. One will be, and this will be a little bit more about it. So the navigators, this is who will be eligible. The health insurances will be the non-navigators, okay? So you'll see the vested interest between the two. Usually the first one, they'll work for more like a community health center, perhaps, or the health department, whereas the second one will not. The states get to choose their own marketplaces and how they do it. And a little bit of it's tied with the money that they also receive. So a lot of people are doing the access point grants. So that it's very complicated how it's all kind of panning out, and they're still changing it a little bit day by day. But to me, it reminds me a little bit of just basic case management related to insurance. that person will have to have a lot of knowledge, whether they're a non-navigator or a navigator, but they won't do as much as a social worker would in a hospital type setting. So that explains that, in the marketplace, they're not going to operate with the non-navigators, but what they are going to operate with is and these are just, again, I just thought, cute photos. And these are all photos from our health centers as well. So all my partners that I have around Arizona, these are all their clients that agreed to show their photos. So the CACs are the Certified Application Counselors. So those are going to be the ones usually at the community health centers or your small critical access hospitals, places like that will be more community-based, and they will be there to serve the clients. A lot of changes, more changes probably to come. October's getting really close, so the changes are going to have to be finished up pretty soon. And you can go to Marketplace, and then, of course, we learned today healthcare.gov opened up yesterday. So there's two good websites there for you, and so that's it, and that's a great picture from Arizona. And if I can be of any help to you in the future, please let me know. Thank you. Yay.